Something's happened the last few days that's beginning to concern our health department.
Now at 6, health alert. New York City sounds the alarm after our I-Team reports on an illness affecting children, possibly linked to COVID-19. Plus, schools closed. Classroom doors in Connecticut won't open again this school year. The challenges and questions that remain tonight. Keeping the subways safe. An exclusive look at how the NYPD is protecting your commute as we head for an historic overnight shutdown. Good evening. Thank you for joining us tonight. I'm Natalie Pascarella.
And I'm Chuck Scarborough. All the major indicators in New York, the epicenter, continue to head in the right direction tonight, and that is down. Total hospitalizations are now at their lowest level since March 30th, but lives are still being lost. 230 New Yorkers were added to the devastating statewide death toll, which inches closer now to 20,000. In New York City, the virus is causing an unprecedented change in transportation. In less than 7 hours, starting at 1 a.m., the subway system will shut down so trains can be disinfected overnight. 1,000 NYPD officers are going to patrol over 400 stations to enforce that service suspension. The city reports a slight uptick in positive cases, but hospital and ICU admissions are down. 140,000 healthcare workers and first responders are going to be tested for antibodies beginning Monday. Hundreds of new workers have been trained to take 311 calls. The service saw a daily peak of 200,000 calls last month. Now, this comes as the tri-state death toll climbs to 30,522, with confirmed case total now nearly 500,000. We begin our pandemic coverage tonight with News 4's Andrew Siff live in Columbus Circle for us. Andrew.
Chuck, you just think about those hospital workers early in the morning heading to start their shifts. The head of New York City Transit told me she's worried some of them may not have heard the details about the shutdown, which is taking place as the MTA tries to crack down on the virus. The MTA calls it the most thorough, deep cleaning of the subway system ever attempted. From 1 to 5 a.m., the impact on 11,000 commuters. That means closing all 472 stations with extra focus on 29 terminal stations. Assigned to the task, 1,000 NYPD officers. What concerns you the most about the first morning for 11,000 people?
I am concerned about folks who typically use the subway system between the hours of 1 and 5, who for all kinds of good reasons haven't been consuming local media and may not realize that the subway system is not going to be functioning during those hours.
Instead, those who work at grocery stores or at hospitals will take buses instead, or a ride share like Uber paid for by the MTA. Jason Anthony commutes at 4 a.m. from Brooklyn to the Amazon offices on Staten Island.
I work in the warehouse, Andrew, and I'm not the only one that is kind of worried about this.
Can you assure commuters that 24-hour service will resume?
Can you assure me? Yes. When is the question? You tell me when the global pandemic is over, I'll tell you when the 24-hour service resumes.
The governor also lectured President Trump and congressional Republicans for not steering federal relief dollars to New York.
You have a national outbreak, a national epidemic, killing thousands of people. You can't put your politics aside even now.
Mayor de Blasio also criticizing the president.
A former New Yorker who seems to enjoy stabbing his hometown in the back, talking about no bailout for New York.
The attacks didn't seem to work. The president tweeted well-run states should not be bailing out poorly run states, using coronavirus as an excuse. Back live, you can see in Uptown 1 train just left the station here. Trains are stopping at 1 a.m. and they will not be running overnight for the foreseeable future. Live at Columbus Circle, Andrew Siff, News 4 New York.
All right, Andrew, thank you. Let's go to Connecticut now, where the number of confirmed cases has now crossed 30,000. That's after adding almost 650 new cases in the past 24 hours. We know, sadly, 77 people were reported to have died overnight. That brings the death toll to 2,633 people. Governor Ned Lamont announced today that all in-person public school classes K through 12 have been canceled for the rest of the school year, but distance learning will continue. We have News 4's Rana Novini live in Stamford tonight with the concerns and, of course, the challenges for parents. Rana.
Yeah, Natalie, of course, this is a tough decision, especially on high school seniors who don't know if they're going to get to graduate in person in a ceremony or if they'll have a virtual ceremony at some point. But parents we talked to today agreed that it's the right choice.
New York, New Jersey, and now Connecticut. All tri-state students now home for the rest of the school year, continuing their classes online. The governor of Connecticut announcing the decision, saying it wasn't an easy one.
This is not the time to risk sending kids back into a classroom. A classroom is not a natural place for social distancing. A classroom is a place where people gather.
The governor says his administration is working with schools to come up with a plan for the fall, which will include guidance for class sizes and PPE recommendations.
I used to love my friends.
Even though she's just in preschool, this 4-year-old can't wait to get back to the classroom. Her mom says it's been hard to juggle being both parent and teacher.
At least for me it is. Like, if right now I'm not working due to the coronavirus, but once I do go back, what am I going to do with her?
It's tough for parents of kids of all ages, but especially hard on high schoolers, seeing their school closed, knowing they're missing milestones and maybe even graduation.
But now I think both him and I get used to it.
Fei Jia says she and her son have built a routine. It hasn't been easy, but she agrees that safety comes first.
And the governor is holding off for now on deciding anything about summer school. He says we can expect a decision about in-person summer school by the end of the month. Reporting live in Stamford, Rana Novini, News 4, New York.
Rana, thank you. In New Jersey, 334 more people died over the past 24 hours. The total number of confirmed cases now surpassing 130,000 in that state. But hospitalizations have dropped 36% since hitting their peak 3 weeks ago and are now at the lowest number since New Jersey started tracking them on April 4th. And as in other states, New Jersey nursing homes have been a COVID killing ground. More than half the 8,000 New Jersey residents killed by the virus, nearly half, lived in long-term care facilities. The Attorney General said today his office is focusing on why these homes were so vulnerable. The governor stressed the importance of staying home and wearing face coverings if you do have to go out so the state can reopen.
Nobody is itching more to get this state back up and running than yours truly and the team up here. But we gotta do it right. We gotta do it responsibly. We gotta do it safely. And we are committed to that, whether folks, frankly, whether you like that or not.
Murphy called on Congress to pass bipartisan legislation to help states like New Jersey as they look to recover from the virus and its economic impact.
The city is now alerting parents to an inflammatory disease affecting children that is possibly linked to COVID-19. This all comes after the News 4 I-team first reported there were several cases of this right here in our area. 15 children have been hospitalized in the city, and of those, 4 have tested positive for COVID. 6 others had antibodies. News 4 government affairs reporter Melissa Russo joining us from the newsroom. Melissa, with the city's new battle plan to keep kids safe.
Natalie, Mayor de Blasio admitting today that they were a little slow to realize this new wave. Now they're trying to catch up so they can track the scope. How are these children presenting? What is their COVID status? And really look at the bigger picture as pediatricians compare notes on the front lines as to what's working. Some of these children are very sick.
If you're a parent, I want you to listen carefully in particular.
Mayor Bill de Blasio and his top health officials today warning parents about a rare but serious new sickness emerging in children.
You have a parachute?
Previously healthy children, like 8-year-old Jaden Hardawar of Queens, who after some mild symptoms went into cardiac arrest.
Jaden has never had any health issues before. He born as a very strong kid.
I'm in bed with him watching TV. And then I heard him call for mommy. I looked over at his face and I saw his lips are all blue at that point.
The new warning from City Hall comes a week after the I-team told the mayor and health commissioner that this was happening to multiple children in our area. They were unaware.
We have not seen this to date.
So I want to thank Melissa Russo, who raised an important issue about a problem we're starting to see, and we take it very seriously.
It's been a terrifying experience for Jaden's parents and dozens of other parents who have watched their children become critically ill after initially believing that children would not be seriously impacted by COVID-19.
Fauci, he tell us how safe it is that children are not affected. So there's something that we never worry about.
The I-Team was first to report cases like this at Mount Sinai, NYU Langone, Montefiore, and Cohen Children's Hospital, where pediatricians and parents told the I-Team they didn't understand why, if pediatricians are talking about this,
they are critically ill.
They just had fevers for 5 days, often have GI symptoms.
Why aren't the health departments talking about it?
Yeah. Melissa, Jim, do you know?
Today, we also tried asking Governor Andrew Cuomo why his team has not been putting out any alerts on this front.
This is something that Dr. Zucker has been looking into, and Melissa has been sharing her reporting with me directly, and we'll have something on that tomorrow.
And we're now finding out that tomorrow, all New York State hospitals with pediatric critical care units will have to fill out this. It's a new weekly state survey asking for a lot of detail about each and every child presenting with this syndrome. It's due tomorrow morning at 9 a.m., which is why state officials may be able to tell us more about the big picture of how this is playing out in New York State. We have not been getting a lot of details from the state thus far, though we have been asking. Chuck?